Welcome to Derm Clarity, Poor Decisions and Flake News. I'm Erica Ramos. I've spent over 21 years in healthcare. I'm a dermatology physician associate, doctorate of medical science, the founder of Restore Scalp, and the host of this podcast. I'm here to help you make sense of your skin without the hype. Just a quick note before we dive in. This podcast is for education only. It's not medical advice, and it doesn't replace the care you receive from your own provider. My goal is simple: to help you understand what's happening with your skin, hair, and nails, so you can make informed, confident decisions alongside your care team. Welcome back to Derm Clarity, Poor Decisions and Flake News. I'm Erica Ramos, dermatology physician associate, doctor of medical science, scalp nerd, and someone who spends an alarming amount of time thinking about follicles. And today we're talking about your scalp. Because what no one tells you about your scalp health is this: clean hair does not always mean a healthy scalp. You can shampoo every day and still have buildup. You can have oily hair and still have inflammation. You can think you have a dry scalp and actually have seborrheic dermatitis throwing a full-out party under your blowout. And honestly, scalp issues are incredibly common, but people are embarrassed to talk about them. Flaking, itching, oiliness, buildup, tenderness, little bumps, all these things can happen on our scalp. And then what do people like us do? We head to social media, where somebody with perfect lighting and no dermatology training will tell you to pour oil on your scalp. And respectfully, sometimes your scalp doesn't need oil. Sometimes it actually needs a medicine. So today we're diving into dandruff versus dry scalp, seborrheic dermatitis, psoriasis, folliculitis, scalp buildup, inflammation, hair shedding, the microbiome. Because your scalp is skin, it's very dramatic skin at times, but nonetheless skin. So let's get into it, because one thing that honestly does not get enough attention in medicine, beauty, or hair care is scalp health. Everybody wants healthy hair. Everyone wants thicker hair, shinier hair, less shedding, less flakes, less irritation, fewer bad hair days. But we rarely stop to think or talk about the actual environment that the hair is growing from. And I really believe this. Healthy hair starts with a healthy scalp. Your scalp is skin. It's living tissue. It contains follicles, oil glands, immune cells, blood supply, microbiome organisms like bacteria and yeast, and it's constantly balancing inflammation, oil production, cell turnover, and barrier function all day long. Yet most people treat their scalps like an afterthought. We'll spend hundreds of dollars on skincare, serums, retinol, peptides, growth factors, red light masks. Meanwhile, the scalp, which is also skin, gets ignored until it starts screaming. And by the way, scalp issues do not discriminate. It's not just a man issue. It's not a woman issue. It's not a curly hair, straight hair, oily hair, dry hair issue. Everybody has a scalp. Everybody has follicles. Everybody has oil glands. So whether your hair is bleached, long, short, protective styled, curled, coiled, shaved, fine, thick, all these things still can affect your scalp. And when the scalp environment gets disrupted, we start seeing things like dandruff, seborrheic dermatitis, psoriasis, folliculitis, itching, irritation, buildup, inflammation, and discomfort. Sometimes we even see hair shedding. And honestly, a lot of people don't even realize the scalp is part of the issue. They think it's my shampoo, it's my hormones, it's stress, My hair just hates me. Meanwhile, the scalp is over there waving a white flag. So today, I really want to break down what's actually happening on the scalp, why inflammation matters, what salicylic actually does, why exfoliation and clarifying matter, and how all of this ties into overall follicle health. And I still want to have this conversation feel approachable because scalp health has somehow become either overly medical or complete internet chaos. There's very little in between. And honestly, some of the advice online is a little wild. Some of it has some data behind it, but some of it's a little wild. And this is where I have to gently break up with the internet for a second because more oil is not the answer, especially when we're talking about conditions like dandruff and seborrheic dermatitis. But before we could even get into these conditions, let's talk about the follicle itself because this part really matters. Hair is not static. Every single follicle on your scalp is cycling constantly. Your hair moves through phases: anagen, which is the active growth phase, catagen, which is a transition phase, and then telogen, which is a resting phase, and actually where hair shedding occurs. And scalp hairs can stay in anagen for years. And that's one of the reasons scalp hair can grow so long compared to body hair. But follicles are increasingly sensitive little structures. Honestly, hair follicles are kind of high maintenance. They want balance, oxygen, good blood flow, healthy circulation, minimal inflammation, a stable environment. They're not going to thrive in chaos. And this is important because chronic inflammation around the hair follicle can absolutely affect the environment the hair is trying to grow in. Now, I want to be careful and scientifically accurate. Not every flaky scalp is causing hair loss, but inflammation does matter. Buildup matters, repeat irritation matters, constant scratching matters. The scalp is an ecosystem, and when the ecosystem gets disrupted, the follicles feel it too. And scratching is another thing people underestimate. Occasional scratching, fine, but chronic scratching and picking can traumatize the hair follicles, break off hair. It can worsen irritation, increase inflammation. And honestly, some people aren't really just losing a hair. They're aggressively exfoliating it with their fingernails, scratching, or even pulling it out like trichotillomania. I see this all the time. People are itchy, inflamed, uncomfortable, stressed, scratching constantly, and the scalp environment just becomes more and more reactive. That brings us to one of the biggest misconceptions I see. People thinking they have a dry scalp when actually they have dandruff or seborrheic dermatitis. These terms get mixed up constantly. Dandruff is not simply dry scalp. Dandruff is actually considered a mild form of seborrheic dermatitis. And seborrheic dermatitis is associated with excess oil production, accelerated skin turnover, inflammation, and abnormal inflammatory response to Malassezia yeast. Now, Malassezia is a yeast that is naturally living on the scalp. The issue is not that it exists. The issue is that sometimes the scalp reacts abnormally to it. And that's what leads to greasy flakes, itching, irritation, redness, buildup. And this is why I cringe a little bit when I see people absolutely drenching their scalp in oils, because Malassezia feeds on lipids and oils. If somebody already has an oily, inflamed scalp environment and we're adding heavy occlusive oils on top of it, sometimes we're actually not helping the situation. You're just kind of moisturizing it and covering up the problem, but in turn actually making it worse. What we're causing is a yeast buffet. And people are always shocked when I say this because the internet has really convinced everybody that flakes must be dry. But sometimes I'll look with a dermatoscope and you can see the oil that is on the scalp with the dermatoscope. It's not dryness, that's buildup, that's inflammation, that's seborrheic dermatitis. That is oil imbalance. Now, true dry scalp does exist. Usually, with a dry scalp, you're seeing smaller flakes, less oil, barrier disruption, environmental dryness, irritation from overwashing, maybe harsh products, colder, drier weather. The winter is brutal on the scalp. People think winter only dries their hands and their face. Meanwhile, the scalp is really going through it. The spring comes around, sweat increases, oil production changes, people start working out more, dry shampoo gets layered on, and suddenly the scalp environment shifts again. And this is one reason I think scalp care should evolve with the seasons as well. And then there's psoriasis. Psoriasis is different from seborrheic dermatitis. Psoriasis is an immune-mediated inflammatory condition, and instead of smaller greasy flakes, you will have thicker plaque with a white, kind of silvery scale. It's going to be much more well-defined, redness, and scalp psoriasis can affect quality of life, comfort, confidence, sleep. All these flakes can make us not want to wear our black shirts, all of it. And this is where salicylic acid becomes really interesting because salicylic acid has been used in psoriasis and seborrheic dermatitis and dandruff for decades. Salicylic acid is one of the most studied ingredients in dermatology. This is not some trendy internet ingredient. The ingredient has decades of data behind it. Salicylic acid is classified as a keratolytic. So, what does this mean? This means it helps loosen up excess keratin, dead skin cells, soften scale, exfoliate, reduce buildup, clear follicular debris, kind of dives down into the follicles, the pores, and helps to clear them out. And also can help reduce oil over time. And it is also oil soluble. That matters because oily environments are difficult to penetrate. So salicylic acid is uniquely helpful in conditions involving oil, buildup, scale, and follicular congestion, which is why we see it used in dandruff, seborrheic dermatitis, psoriasis, acne, oily scalp conditions, follicular buildup. There's also evidence supporting anti-inflammatory and antimicrobial properties with salicylic acid. Now, this is where I want to say something important. If somebody has severe scalp psoriasis with thick plaque, they still need a dermatologist. They may need prescription topicals, steroids, vitamin D analogs, biologic, injectable medications, systemic therapies. Supportive scalp care is not really replacing dermatologic care. And I think it's really important to say that. But supportive scalp care can absolutely help symptomatically, reducing buildup, helping with scale, supporting the scalp environment, helping people feel more comfortable between washes. One thing that always fascinated me clinically was contact time. Most people use medicated shampoos for honestly, people, you are not leaving this on 5 minutes in the shower. Maybe 20, 30 seconds. Be honest. People put it on and then immediately rinse it off with your medicated shampoos. And many active ingredients need longer exposure time to really do their job. If you think of it as a medicine, you know this. Putting it on and immediately rinsing it off is not going to do anything. And I think that's why most patients come into dermatology having tried and failed over-the-counter treatment options because contact time matters. And this is actually part of what inspired me to make Restore Scalp. Not creating another trendy hair product, not replacing prescription therapy, but asking, how do we support the scalp environment between washes? And how do we continue to exfoliate and clarify in a lightweight, wearable way that doesn't interfere with people's daily routines? Something that doesn't feel gritty, something that doesn't feel heavy, something that isn't coating the scalp and feeling occlusive. Because a lot of people are already overwhelmed. Dry shampoo, sweat, workout classes, heavy products, oil layering, stress, 3-day-old messy buns, leaving your hair up wet, life gets in the way. And the scalp has been managing a lot. And speaking of the scalp environment, we also need to talk about folliculitis because this is a category people misunderstand constantly. Folliculitis simply means inflammation involving the follicle, but not all folliculitis is the same. Some forms are bacterial, yeast driven, inflammatory, friction related, occlusion of the follicle that's happening. And so there's bacteria folliculitis that involves bacteria like staph and other species of bacteria that enter the follicles. You may see pustules, tenderness, inflamed bumps with that. Then there's malesthesia folliculitis. So we've talked a lot about malesthesia already in seborrheic dermatitis and dandruff, but it can also cause folliculitis. This tends to be more yeast driven and often presents like little smaller itchy bumps that are more uniform. And these conditions are often worsened by sweat, heat, oil, occlusion, friction, and then heavy buildup, like occlusive products potentially. And again, the follicle environment matters. Oil, dead skin cell, debris, heavy buildup, occlusion, friction, all of these things contribute to follicular stress. Folliculitis is basically your follicles saying, absolutely not. We reject this environment. And I think one of the biggest shifts happening right now is that people are finally realizing scalp care is not just cosmetic, it's medical. Healthy hair may be cosmetic, but healthy scalp is medical. And the two affect each other constantly. For years, we've focused almost entirely on styling and appearance. And now we're starting to appreciate the microbiome imbalance, barrier function, inflammation, follicular health, scalp environments overall. This is where dermatology and beauty work together because people want comfort, confidence, less itching, less flakes, healthier hair, fewer bad scalp days. And those things start at the scalp, not at the ends of the hair, not with another styling product, not with another heavy oil. They start at the root. And if there's one thing I want people to take away from this episode, it's this: your scalp matters. The environment surrounding the follicle matters, and supporting the scalp before things become severe can make a meaningful difference. If you're dealing with severe inflammation, thick plaques, scarring conditions, persistent folliculitis, or significant symptoms, absolutely see a dermatologist. But for everyday support, reducing buildup, helping maintain scalp balance, supporting healthier follicular environments, and improving comfort, there's a lot Restore Scalp can do. I think this conversation around scalp health is only just beginning because at the end of the day, your scalp is working hard for you every single day. Maybe it's time we start treating it like it matters. Thanks so much for spending time with me today on Derm Clarity, Poor Decisions, and Flake News. My goal is simple: to help you understand your skin so that you can make more confident, informed decisions. Because at the end of the day, better skin starts with better understanding. And here on Derm Clarity, we're all about making better, poor decisions without the flake news. When you understand your skin and stop guessing, that's when clarity begins. Because great skin isn't just about what you put on it, it's also about what's happening underneath. Thanks for hanging out with me on Derm Clarity, Poor Decisions, and Flake News. I'll see you next time.